Immediately the virus infection broke out in China, we had a response strategy, and that strategy was based on the fact that we believed the entry of this virus into this country would be by air. And we started immediately scaling up testing at our airports. We are among the first in the world to start this testing, rigorous testing. We developed questionnaires, and I believe many honorable members here who travel around that period will have found that even in London and Paris, they were not doing any questioning, they were not doing any testing. But here in Nigeria, we're doing testing, we're checking your temperature, we're checking your travel history, and watching very closely, listening to what was happening in all parts of the world. In fact, Nigeria was commended by the World Health Organization and later on by the Secretary General of the UN for being very proactive in preventing this disease. There was in fact a case of one Nigerian during that period who came in from Wuhan, because we were in touch with our embassy all the time on a very regular basis at the embassy in China, and we got information that this gentleman had come in and somehow or the other slipped through the control mechanism and was inside Lagos. We sent a message to the Lagos team and they tracked him down in his house, put him under observation. Luckily, he was negative. That would have been our first case. But the first case was to come in again. He had no symptoms at the time, and by the time he entered Nigeria, 2 days later, he had been identified, also thanks to a very efficient doctor who saw him. And then the contact tracing of 179 people were done. The one who was positive, they were put immediately into isolation and treated. So the mechanism started very early, and we did well, and because of that, our cases never really rose very high like in other countries. But then, of course, the appearance of many travelers and many people overwhelmed the mechanisms we have, and it was no longer possible to control, to do all the contact tracing that followed. Now, to specifically to the questions, are the testing centers in Kano enough? For now, 3 of them, yes. The testing capacity is probably less than 50%, but as the need arises, it will increase. It will increase everywhere else in the world, in Nigeria, because we are getting access to more testing kits and also access to more testing machines. The use of artemeter, yes, we are participating in clinical trials, and these trials involve pharmaceuticals. We have in Lagos, in Abuja, we are using things which the World Health Organization set up, a system called Solidarity, to study the efficacy of certain drugs in treating COVID-19, and among them hydroxychloroquine and the azithromycin, which were said to have been successful in some countries, although we didn't see the impact. And the chloroquine, I'm sure artemether will be among. Is there a vaccine among them? No, we are not doing vaccine tests. We are not enrolled in any vaccine trial because the processes have not yet been developed enough for them to be safe enough. Once they're developed well enough, we may consider taking part. Now, as for those who are getting medical attention,
Chairman Finance,
the purpose,
Chairman Finance, please disband that your caucus. Chairman Youth.
The purpose of isolation. There are 3 categories of people who get infected with COVID-19. There are those who are completely asymptomatic. They have those symptoms, they feel very well, they don't believe that they are sick. There are others who have moderate symptoms and they will require treatment. And there are those who have critical symptoms, and some of these ones will require ventilators. They are less than 5%. But the majority of them will have those symptoms, particularly the younger ones. The older ones and those who have other diseases, maybe hypertension, diabetes, kidney disease, and so on, those ones who probably don't have enough capacity to build antibodies, they will fall sick. Those are the ones who will require very sophisticated treatment. Luckily for us, we have not had that many yet. We have only a handful. We have only had to use only a handful of ventilators, and that has not been a challenge here. But those who are without symptoms, they are capable of transmitting this disease, and they are particularly a high-risk case, because they might be sitting with those who are vulnerable. And those who are vulnerable will now get it from them while they remain healthy. or relatively healthy, the vulnerable will stand the risk of losing their lives. So the strategy is to keep everybody who's positive in isolation until they test negative. Once they test negative, they leave. Now, during that period, because they have no symptoms, they may not be given anything at all. They may not be given any medicine, they may be given only vitamins.
Chairman Youth,
They may be getting,
please take your seat.
they may be getting only vitamins and supportive treatment. So some of them feel that they are wasting their time in there. They are not getting any treatment. In reality, the healing from COVID-19 comes from your body building antibodies to tackle the virus. If you build antibodies very highly, you tackle it more easily. Those who don't build very well will have a serious problem with it. That is why among the fatalities, rarely you will see any person under the age of 20. Most of them are above 30, and the highest percentage are those who are 50 and above, particularly those who have illnesses like cancer, HIV, anything that prevents their body from being smart enough to build the antibodies to tackle the virus. Research, yes, we are participating in, other research we are participating in is in using convalescent serum. Because the theory is that if somebody has suffered from coronavirus disease and recovered, will his serum contain the antibodies that can be used to treat somebody who can't be treated otherwise? We are participating, we are trying to do that one in Lagos. We are waiting for results from the Honorable Commissioner of Health in Lagos is luckily an infectious disease specialist, and here in Abuja we're also looking at participating in using convalescent serum. Many countries are trying to do the same thing. So the other question is regards to Kano, whether these deaths were due to COVID-19. That is the subject of a very sad and serious distortion of news. The person who's heading the federal team in there did not ever say that the people died from coronavirus disease. In fact, that very morning when the news broke out, we had just spoken, and he told me they're carrying out investigation along 3 streams. And we discussed the streams of investigation being conducted by Kano State and supported by pathologists from the Federal Ministry Health System. So that test is still going on, there are no results. But in giving an interview, the reporter totally distorted the statement that he made. And since then, the report has been withdrawn, and they have apologized to him. So there was never a case of him saying that 80% of people died from that or any other disease at all. Now, steps that are being taken to improve the outcome in view of the changing of the lockdown and relaxing. The handling of coronavirus, of COVID infection, is the subject of the Ministry of Health, but also a subject of the communities, because the influence of the community leaders is extremely strong in persuading people to cooperate. We are talking now about social distancing, physical distancing. This is something that I believe community leaders, religious leaders, and traditional leaders will handle. Because if we believe that if we are able to talk to the leaders, political leaders here, they can help us drive that. The success of this next phase we are going into now depends on the success of these social non-pharmaceutical measures. If they succeed, we shall be happy. There are some people who have raised apprehension and said, some countries relaxed their lockdown and then their figures spiked. Well, at the moment, our figures are actually still rising. So if they still rise a little during this period, it's not necessarily due to having relaxed the figures. But if we are able to keep all these social measures which have been added, for example, compulsory wearing of a mask, social distancing, limiting the number of people who can enter a market, limiting the number of people who are at a gathering, hand washing, and so on, several measures that have been introduced, if we are able to put them into practice, we shall not see a spike due to having relaxed the lockdown. And the lockdown itself that has been relaxed wisely because farmers must go and plant. Goods and farm products must be able to reach destination. People can rebuild their businesses and rebuild their livelihood. The lockdown has led to the collapse of many, many livelihoods and small businesses. So it opens a window for people to rebuild their lives. At the same time, if we actually strengthen and reinforce the social measures, we shall not suffer any consequences. So it's a very narrow path, but the wisest path that has been taken by His Excellency the President to win on both sides. And we are praying that and hoping that honorable members here will support those initiatives. Now, the local treatment testing capabilities, yes, they are being expanded. We are increasing the number of sample collection centers. You don't necessarily have to put a testing machine everywhere because you need to train the workers, and also the capacity that we have now is not being fully utilized. So if you have a machine that can do 1,000 tests a day and is being used maybe to do 300, there's 700 spaces remaining. So the best you can do is collect samples and have an efficient method of bringing them to a testing center. This is what they do in many countries. Many countries are doing it like that. With regard to the gene expert machine, yes, we have this access to funds from the Global Fund, which we applied for them to allow us to repurpose some of the funds in there to be able to take care of our needs there. And part of what we requested was for them to allow us to use cartridges that are used for gene expert machines. So our order now, which will come with me in a few weeks, is for 107,000 cartridges for gene expert machines, and also 26 biosafety level 2 cabinets that go along with using the cartridges on the gene expert machines. So we are hoping that within a couple of weeks, this will be taken care of. We have placed the order, we are on the queue. Because of global demand, everybody who orders, you are on the queue before you get your own supply. So we shall have the privilege of getting gene expert machines, and possibly one for every, at least one for every state of the Federation, and probably even more for large states with such a distance that logistics is difficult. Now, local production of PPE, yes, we have been talking with the Ministry of Industry, Trade and Investment. We've had a meeting with them, and we have also spoken with the Manufacturers Association. There are many initiatives to produce masks and also the protective gowns. We have met even with some government companies who have told us that they are able to do that, so we are going to place order and rely on ourselves. That's what most countries are doing. There's a global shortage of masks, global shortage of gowns. The latest country to complain of shortage now was the UK and also Russia. So we are in a global competitive environment to get things that we like to use to protect our healthcare workers, but at the same time using the opportunity to develop local production capabilities. And we hope that that will help us to relieve the pressure on money shortages, although we don't have real shortages at the moment because we have been insisting on a good stockpile of what we need to have in the country. The perception of coronavirus as a big man's disease, that was the beginning, yes, because we all knew that it was imported. You had to have gone abroad and come back with an infection like that. So a lot of people believe that it was only the concern of big men. So at that time, what you do is get the infected person, trace his contacts, and then you can arrest the disease at that time. But by the time it filters down to the grassroots, it's no more just a big man's disease. It's everybody's disease. That's why we call it the community transmission phase, because now the people who have it are people who don't even know the way to the airport. They have no passport, and you cannot tell how they got this infection. So this phase requires a completely different process, a completely different strategy. So the Ministry of Health is working on a action plan, a community response action plan, which will be out by next week. And we also set up a committee of expert advisors headed by Professor Tomori, who will be helping us, a very well-known virologist, to set up the strategy for this phase now that the entire country is going to be involved with it. So the isolation centers, they are being managed by doctors and nurses, and for those who are very well, really, the only thing you need to do is to entertain them. So entertain themselves. Some are dancing, and we also have mental health experts who talk with them, because the boredom there can be very, very difficult for some. Nevertheless, there are people who also run away and some who don't even report at all. So we are very concerned about that. I would like to use this opportunity to let the members of the House know that they should help us to get everybody under control, because any person who is not accounted for might be, so we are trying to trace the contacts. Now, the use of local herbs, every person who comes to say they have local herbs, we refer straight away to our Nigerian Institute for Pharmaceutical Research and Product and Development to go and show them, analyze it, see whether it works, if it works, so that we can make the best use of what we have. We are not dismissing anything. We are not throwing away any idea that comes. As for the National Orientation Agency, yes, we work very well with the Honorable Minister of Information and all the agency under him. He has been to our office so many times. He has supported us with trying to get access to radio, to get access to TV, so that we can push the information, because if the population is not well informed, they are not going along with us, the story will be extremely difficult. So, the face masks, yes, we have also pleaded that donors and philanthropists should make masks available. Masks will be the easiest and cheapest way, but it's not a replacement for community, for distancing, for social distancing. But we know that in very highly densely populated cities, like places in Lagos or Kano, where it's difficult asking people not to isolate. So they are packed together already. So the next easiest thing you can do is give them all masks, so that they know that they wear the mask and they wash it every evening and put on the mask. So that it's not the full answer, but at least it's better than nothing. And also when they leave their homes, they wear this mask and make sure that they wash it every day and don't use it without improving the hygiene that goes along with it. So I've already mentioned what we have done since the days of China, and the manpower development is according to need. The NCDC will speak to that, but we have also been doing deployment of manpower as the need arises. Our number one virus research center and hospital in this country is in Irua. That's where we have the team who went to Liberia and Sierra Leone to go and help them with Ebola. That's a major center for Lassa fever, and all these are virus diseases. And this is also a virus disease. So we have been bringing those people here to come and help us set up here in Abuja. We have also sent them to Kano now to go and help. There are about probably up to 8 of them in Kano as I speak now, helping them go through the protocol, because we have some issues there of people getting infected. But these people are experts in knowing how to ward against all these infections, and they are going to help to set up the processes in there. The SGF has spoken about the health insurance, the shortages of equipment we have spoken about. Now, the situation in other states, what we are doing is that in anticipation of problems in other states, particularly in the north, where we are already seeing galloping figures, we have set up a mechanism to ask those states to bring doctors and nurses in various areas to come to Kano and receive training, because the team that we have sent in there is doing a lot of training capacity, so that one day you hand over everything back to Kano. Kano was caught off guard with all of this. But to bring people from other states, even before they have any high numbers, so that they already have a manpower to start with. So they go back to their areas, they already have doctors and nurses who have been trained in infection prevention and control. They have been trained in protocols of hygiene and how to prevent infection, until you are ready to really set them up, even if they don't have any cases yet, to be pre-trained. So that's the strategy we are using to make sure that we address other states in the north, particularly, also some of them in the south too. The question of restricting travel, that is a very critical part, because even in Kano right now, 95% of all the cases are in the municipal local government areas, about 7 or 8 municipal local government areas. If there is a way for us to be able to cordon these local governments, discourage them from traveling by giving them the things they need, then the risk of carrying this infection to other local governments is reduced. And the majority of cases that have popped up in other states in the north, were due to people who travel from Kano, and they already carried this virus and they didn't know. So if we are able to restrict this travel, even though it is within the state, it will help us a lot. We have also followed the President's advisory that interstate travel should stop for the time being, except for essential goods and essential movement, so that people are not carrying this virus from one place to the other. So there's a possibility to restrict the transmission of the virus from one local government to the other if the state government and the local government cooperate to limit movements within local governments, except for very essential movements. That will help a lot. Now, the ventilators, yes, we have a lot of ventilators. We have received them from donors from outside, from the United Nations group and so on. So we have also looked at all the ventilators we have. But the ventilator is like a car. You have to learn how to use it, and there are not many people who know how to use it. So we have also embarked on a special crash treatment protocol to train those who know how to use it. That Society of Anesthetists, we have been in conversation with them to do crash courses in Lagos, so that we train people from various states who do not have specialists in intensive care medicine. This is already intensive care and critical care medicine, to make sure that they get the knowledge and the skills. That situation is going on very well. And then finally is the case of the incident in Kano, not only in Kano, but in other areas where private and public practitioners are turning away patients because they are afraid. It has happened in Kano, unfortunately, in other areas too, that patients who appear at the hospital are not treated because they are worried, and then you are getting this situation where people are losing their lives due to other things that are not even COVID related. So that is not a good situation. That is one of the reasons why the primary health care sent somebody in to go and remobilize and retrain and inform people in Kano, and the ministry also sent a family health expert to talk and reorientate all the hospitals, both private and public, about the value of keeping family medicine going, immunization, antenatal clinic, and care for diabetics, blood hypertensives. All these ones must go on, and particularly also malaria, because if you don't attend to all of these, they can take more lives than COVID. So we are emphasizing that service, delivery of routine service must continue and must not be something that is ignored because of fear or of COVID, or focus on COVID. Because the symptoms are cough, fever particularly, and sore throat. So you can give medication that reduces those symptoms, but it's not cured in that the virus is still active. So, but it relieves for the time being. At the end of the day, it is the person's body that must build the antibodies to neutralize the virus. And giving a normal healthy person, mostly young people, they will do that in a short time and be able to neutralize the virus. But the capacity to build antibodies is exactly the problem. Some say they are giving immune boosting medication. Well, whether it is proven or not, so far it doesn't do any harm. We do not discourage anybody from trying it. So those who give immune boosting, yes. Now, to actually cure the virus, it was thought at one time that, to actually destroy the virus, it was thought that chloroquine would do it. But the tests are still going on whether that is true or not. Countries where they tried to use chloroquine didn't really show any dramatic reduction in their cases, or hydroxychloroquine or other. But again, that is not, the jury is still out on that. The other new trial is an antiretroviral drug, which I think the United States just wanted to start using. But we have been using that, we have tried that in Lagos too. So we are trying the antiretroviral drugs to see what effect it has. But as far as local content, local drugs are concerned, we have to test the toxicity. Does it have side effects? Does it have undesired effects? Can it do the work, or at least will it not harm the person? Because some medicine can do harm rather than good. So for that now we need to have trials done. Luckily we have a research center, the Nigeria Institute for Pharmaceutical research. They are very good. They have a lot of professors in there who can look at these things and tell us whether they work or not. So all local herbal cures will be referred there for evaluation and for the efficacy and for the toxicity to make sure that anybody who uses local cure is safe, and also that it works. Even if it works psychologically, it's also fine, but so far it doesn't do any harm. That is the content, local content so far.
Thank you very much.